Just go down and see if there is a, you can tell the people to log in now.
Okay, sir.
Vijay, am I audible?
Yes, yes.
Vijay, I'm saying that give us just 10 or 15 minutes that we should do our lunch.
Why?
In a line. We have not done yet, or we have not completed our lunch yet. We have not get the lunch yet.
Hey, Deepak, Deepak, can you hear what?
Yes, yes,
I
I
think
heard
they
it.
did not.
So
do one thing.
Yeah, maybe whatever existing people will do it, and then the other group can share because there are patients in the clinic. Once I go back to the clinic, coming back may be difficult.
Okay,
Or
do
they
one
stay.
thing. Yeah, just share whatever it is. If I'll summarize, like it's not a what you call the topic or the content to say as per se. So yeah, guys, yeah, let's do then, Deepak. So guys, there is a small change in the schedule. We are supposed to have a preclinical training, the orientation to that, but there is a small change, and we are doing the subspecialty training orientation. Dr. Deepak Kumar Bagga with you, and Dr. Deepak Kumar Bagga associated with us since 2007, and he holds a PhD degree from UNSW Sydney, and he is a passionate Leuven practitioner at the institute. And prior to working with us, he had a stint at the Shroff Charity Hospital at Delhi, and he moved with the passion to the Leuven practice to the institute in the 2007, and since then he associated with the institute as a Leuven practitioner. And most of you and those who are in CAR campus will go through his rotations and the clinic, and he is a wonderful teacher and particular emphasis on refraction skills. And with the new internship model, what we are describing in short, so you'll also engage in that part. And of late, Deepak moved with inclination to the education, and you will be part of the lot more education activities with the group, particularly with the internship. And he's also given the responsibility to the first ever we are doing for the first time the subspecialty training. And I requested Deepak to give a basic orientation to subspecialty training post your preclinical training, and Deepak Bagga will talk about what will be delivered in short. And that's a 2 weeks course. We cannot cover in 10 minutes, so you'll try to give a, I would say, teaser. So it's a more common term to use it now. So you'll give a teaser to the what will happen in subspecialty training. And with the short intro, I'll leave it to Deepak, and maybe after Deepak, when the group comes, maybe I'll take some points from you. Maybe I'll summarize if there is any time I get it. Otherwise, I'll also ignore that if some of them miss. But anyway, they'll go through the training. We're not going to miss them. So
yes. Thanks, Vijay. I hope I'm audible there, right?
Yes, you're audible.
Okay. So, and can the student unmute themselves and then they can talk?
Yes. So everyone should switch on the videos at least, but they can unmute.
Okay. So I think that should be possible for them to unmute or at least write a message in the chat box.
No, they can unmute, Deepak.
Okay. So just wanted to have an understanding that in optometry, have you heard of any subspecialty word itself, that subspecialty of optometry?
Any
if you have
volunteer?
heard of yes, then probably you can describe that what are the subspecialty, what does subspecialty mean to you, and then what subspecialty you are aware of, that these are the possible things that
You can type in the chat box yes or no. Then if yes, maybe write the what subspecialty topics you are aware of it. Only one responded. Guys, I told you in the morning. So right or wrong answer is not the response. If you don't know, yes, no.
you can check on
I'm
Google
see-
also.
I'm-
You can Google it and then
Okay.
answer it also.
Some of them wrote yes, and vision therapy, pediatrics, low vision. Don't need to answer, just write it. Yep. Sports vision, low vision, glaucoma,
Vision
prosthetic.
therapy. Cornea.
Yes,
Contact
Shubhi Varshney, you want to say something?
Guys, one by one.
Vision therapy.
Deepak, don't leave it to this. They will all will. Guys,
Okay. So
switch off
Shubhi,
your mics, please.
so Shubhi is saying something. Let's focus on that. Yes,
Guys,
Shubhi
only
Varshney.
one. Yeah.
Yeah.
What's her
Shubhi-
name, Deepak?
Shubhi Varshney. Shubhi Varshney was
Shubhi
speaking.
Varshney.
Low vision, sir.
Low vision and
Sir, vision therapy.
very good, Shraddha. So I see one message here in the chat box by Chayan Pramanik, cornea, anterior segment, contact lens, vision therapy, orthoptics, oculoplasty, dispensing, posterior segment somebody has added, vision therapy. Okay, so when you're talking about subspecialty, basically what you're talking about is a very narrow field, a smaller area of knowledge and skill set. But why are we talking about when you're at the entry level, just entering the optometry to learn about the subspecialty? Okay, so herein what is important for you to understand that even when you say about the total eye care or comprehensive eye care for comprehensive assessment, you need to understand because when patients come, they may come to you in whichever clinic you are posted or in whichever place you are working, and their requirement may be different. So for you to identify which subspecialty may be able to deal with them. So that is why the basics of these subspecialty is very important. And the agenda what we are going to cover in the 2 weeks and during your internship of 12 months or 13 months that you are in the program, the subspecialty component will be of very basic level, and the basic is for you to make a best comprehensive optometric clinician, so that it is not that your focus is just in one direction or your understanding is just fragmented, but for you to have an overall complete better knowledge, better understanding. And then as you listed down the various subspecialty, starting from the lid, if you start, so which means you're talking about plasty, oculoplasty. So if someone comes to the ptosis, how do you take the measurements there, right? So if somebody comes to the orbit related issues, ocular oncology, so those are all plastic related things. So very basic thing, if a person comes, what kind of history has to be taken? If you're talking about anterior segment, the cornea, the contact lens related, the prior user, what are the things that you should be knowing, which you should be asking, and what kind of assessment needs to be done in the primary level eye care? So that is something which you need to know. And here in another 2 weeks, we will be learning the prerequisite so that you are familiar with the basics, the fundamentals before you are posted in those subspecialties. So when you're getting your posting on, say, first month in the cornea clinic or low vision clinic or retina clinic, it is not that you're not familiar that, okay, if you're seeing a person with sudden vision loss, what are the additional details you have to ask? How do you do the assessment? In which case you have to check the projection of rays? How do you assess vision in those cases? So those basic fundamental things, probably the exit competency skill would be different, wherein you are adequately trained to manage those cases as an optometrist. That would happen only at the end of it. But yes, in the beginning, what are the prerequisites? We would be focusing in the 2 weeks. So I've asked my colleagues who are heading these subspecialties to provide me with a list of training material and other things that will be passed on to you. So it will happen over a period of 2 weeks time. So we understand that 2 weeks is not sufficient for you to master all those areas, but yes, you should be able to learn those basic requirements. The purpose there is twofold, I would say. One is to provide a quality standard eye care to the person reaching out to us. And the second is ensuring the safety of those patients and safety of actually everyone. So in that context, you would learn that what not to do and what is in the scope of you for you to be able to perform independently. So certain things that you can do independently, certain things probably you may not be performing it, but yes, you can observe and still learn till you become confident to perform those tests. Okay. Any doubts so far? You can put it in the chat box if you are having any doubt related to subspecialty. So while we are talking about subspecialty, you're focusing still on the basics, the fundamentals, so that your comprehensive evaluation, comprehensive understanding about the eye and about the optometry practice is still there. The focus here is, and the purpose of this subspecialty training is that so that when you are posted in the subspecialty clinic, you have a basic understanding, so that when you are working up those cases, when you're examining those patients, the quality of patient care does not get compromised. So because we are committed to provide the quality care to these patients, so certain minimum standards that you need to know. Unless you get those things, unless you get those prerequisite skills, you will not be posted in the clinics for those specific clinics. So you may be posted in the comprehensive clinic, or you may be shadowing doing the observation. You will not get the independent posting till you're confident or comfortable in performing those basic skills. And then it is to primarily, again, to ensure the patient safety there. And can anybody tell me what is the meaning of optometry? Any of the optometry student, any of the intern? Do you understand what is the role of an optometrist? Yes, Chayan. You want to
Yes,
say
sir.
something? Yeah, you want to say something?
Yes, sir.
Yes, tell me, what is the role of an optometrist?
Excuse me, sir.
Yes,
Sir.
Radha Agarwal. Yes.
Sir, opto means vision, and metry means measurement, vision measurement, like diagnosis and treatment of eye.
Okay. Okay. So
Sir, basically, optometrists are eye care professional.
okay.
Changing
And main role is to detect the defects and abnormalities of patient.
Okay.
basically changing the versions of lights.
Is that the meaning of optometry? Changing the versions of light. That is basically the refraction, right?
Basically, optometry is a primary healthcare profession where we provide a primary treatment.
Okay,
to the
so
patient.
those are the scope which you are describing. So if you see that Chayan has mentioned something in the chat box. Okay, so herein primarily you're responsible for taking some measurement, right? Okay, so some measurement related to vision, visual functions, about the refractive error. Okay, and certain other biometry and other things which you will know again. So those are all again measurements. Okay, so if you are primarily responsible for vision related or eye related different measurements, so in the measurement, what is important is the reliability, the accuracy. And how do you ensure that? The reliability measurement is something that you would get to learn through your training, that how do we get the more precise, more reliable measurements. Okay, and the very fundamental is something what I would recommend, because as you're entering the profession, as you're entering the program, let's take an example. When you buy a mobile, what are the things that you look at? If you can just type it rather than unmuting and saying, what are the things that you look at when you're buying a mobile? What features do you look at? Okay, so people have different thought process right here. So some people look at the, because if you're using it for the photography, then you would be focusing on the how well the camera functions. If you're using it for the gaming, you would look at the processing speed, function, and all those things. If you are taking an equipment for measurement, you would look at that, how durable it is, how well it will help me to record my measurement. Okay, so similarly now you'll be, because if you're going to practice something in your clinical practice, you'll be buying some ophthalmic equipment. So you have to be really mindful about how do we get the best, which equipment price is important factor, but at the same time, which equipment would get me the best measurement. Okay, and which one is considered a gold standard or something which is time tested. So maybe you want to check with the people who are into practice, that from where do they get it, what kind of material do they get it for their use, and how was their experience and their feedback. So learning from them before you really get into, because you may have a variety of range that are available, but if you get something which doesn't work, then there's a problem in the clinic. If you're saying that, say if you have a scale which doesn't measure things properly, would create problem. So on one end, yes, you are focusing on your skill set, you are learning the techniques. The second thing, to learn those techniques, you need to have proper equipment. And third thing is, that is of very importance, is it because you're dealing with patients, your communication skill, your soft skills. And herein, if you're getting posting in Andhra or Telangana, Vijayawada, Vizag, or in our Hyderabad campus, then you need to learn Telugu. And if you are getting posting in your MTC campus, then probably Odia, at least the functional Odia, so that you are able to get the accurate and correct history. So those are the probably prerequisites in addition to the subspecialty training. So even if these are not listed, probably I'm not sure if those are listed in the preclinical training, but before you are posted in the clinic, you would be expected to master or learn at least the functional language. So if you're based in Telangana, Andhra, then learn Telugu. If you're based in Odisha, then learn Odia. If you're not familiar with those languages, so starting from day one, ensure that at least 10 sentences, if it is difficult, maybe 2 sentences every day you learn new. So if you're learning 2 sentences every day, but at the end of 45 days or 30 days, whatever you're having, you'll have at least 60 to 70 good sentences that you can speak, you can understand, and you know the answers of those also from the patients. Okay, so with this, I'll stop here. If you have any questions related to subspecialty module, you can ask me now. Otherwise, also I'll be available and I'll be interacting with you frequently? If there are no questions, then probably I'll move to the clinic. Thank you so much for patient listening, and I'll hand it over to my colleague Shailaja to talk about the
you.
preclinical.
Thank you, sir.
Welcome, Arpita. Welcome, Titi.
Uh, Hello, everyone. Good afternoon.
Good afternoon,
Good
ma'am.
afternoon,
Good
ma'am.
afternoon, ma'am.
Good afternoon. Just give me a couple of minutes. Okay. I'll just start the session. Okay. So I can see only 88 over here. Is that only 88 is the number, or is there anyone who left and will be joining in some time? Okay.
Ma'am, actually there is more than 88.
Okay.
Ma'am,
They are
actually,
not,
few of them are having network error. That's why they have not joined.
Okay. Second.
Some students are joining from MTC campus. MTC campus.
Okay. MTC campus, everyone is in the one auditorium room.
Yes, Shailaja. Yes, Shailaja. At MTC, GMRU and KVC.
Okay.
So at one place, all students are at one place.
Okay. What car
So MTC total 17 are there. GMRU 18 plus and KVC 14 plus.
Okay, sure. So is there anyone that they'll join, Rajesh?
Sorry, Shailaja.
Still anyone else to join, or can I start the session?
You can start, Shailaja, please.
Okay, yeah, sure. Hey.
Thank you, Shailaja.
Thank you, Rajesh. Yeah. So once again, a warm welcome to LVPI. So, and congratulations all of you for being selected to the clinical internship program at BHIOVS. Okay. So I think since morning you are having a series of lectures where you are learning about, so how would be the, so now you are part of LVPI family, right? So you should all know the protocols, and then how is your internship going to be way forward, and what are the various things you are going to learn, and what are the various teaching methodologies what we have been adopted to make your internship more, make it more valuable to you. Okay, so as part of this, so you already, Vijay might have introduced you that for the next 1 month across the network, so every one of you will be undergoing something called preclinical training. Okay, so only once you clear the module on preclinical training, then your actual internship clinical rotations will start. Okay, so I'm going to introduce you on the preclinical training module. How is it going to happen? What are the various things what you're going to learn under the preclinical training? And why is it important for each of you to have this module before you start your actual clinical rotation? Okay, so just to introduce myself, so I'm Shailaja. So I completed my bachelor in optometry from Washington School of Optometry in the year 2008. Later, I went on and I completed my master's from Elite School of Optometry in the year 2010. So since 2010, I've been associated with LVPI. So as a faculty, so currently I'm heading the preclinical training module across the network. And in addition to that, I'm also be teaching some of the subjects like clinical examination system and then clinical techniques. So just to, before I tell you about what exactly the preclinical training happens to interns specific to your thing, I'll just introduce you to what exactly is the preclinical training and what happens over there. Okay, so is my slides visible?
Yes, visible.
Yes, ma'am.
Yes, yeah. So the major purpose why we introduced something called preclinical training is that I think in the year 2016 is what is we started this called preclinical training. So just to, for every trainee who come to BLSO or who is being part of the LVPI, to just give them an extensive skill oriented training. Okay, because it's not that we get trainees across the India and even some parts of the world. So everyone of each of you come with a different knowledge. Each of you would come with a different way of schooling method of learning. So you do have a different ways. How do you do the technique? How do you document the technique, or how do you interpret the technique? So it is always important to have one uniformity, or it is always important to have LVPI protocol in the way what we perform the technique. Okay, so and with an intent, with a background that, so not everyone will have enough hands-on experience on a given technique. You may have the clinical knowledge, or you may have the knowledge about that specific technique, but you may not have the enough hands-on experience on the technique. For example, you might have learned slit lamp. How do we do the various slit lamp examination techniques? You might have learned it, but you may not had enough experience of practicing each technique, or enough experience of doing on multiple times on the technique, or you may not have the exposure of how do you document it, or how do you interpret the results of the particular technique. So to give you an extensive skill oriented training on the comprehensive examination techniques, and also the how do you document and how do you interpret the technique, this clinical module will help you out. Okay, so this is what is exactly is the fundamental course which is going to run, so that your subsequent clinical training, which happens during the patient care observation, will all depends upon how confident you are in doing this fundamental techniques. Okay, so that was the major purpose of introducing you to the preclinical training. So the mode, how do we deliver the preclinical training is, we do have a combination of lectures, we do have a demonstration, we have a video presentation, we have a role plays, and also hands-on clinical practice, and faculty will be there mentoring you while you are practicing the technique on each other. Okay, so to just give you it's not only to the clinical interns who undergo this module. Whoever the trainee who enters into LVPI for any kind of training, it's a must that the trainee should finish it off the preclinical training, clear the exit competency exam, and then they start the actual clinical rotation. The reason only when we feel that you are confident enough in handling the patient, then only we allow you to start the clinical rotations handling the patients. So that's what is, we made it mandatory that every student, every trainee, irrespective of the training program, whatever they enter it, it is must that they have to undergo the preclinical training. The duration may be different. They have to clear the exit competency exam, and then the actual training process starts. Okay, so like I said, it's we do have vision technician program. So Vijay would have already told you the various programs which LVPI offers, right? So all the programs whichever is happening, so they undergo the preclinical. The duration is, some will have as long as 2 years, where the BS optometry guys, they undergo 2 years of preclinical training. Some may have as short as just 2 weeks. That is the ophthalmologists, they undergo 2 weeks of training program. And when it comes to the interns, okay, so the duration is what is the 4 weeks duration. So you undergo 4 weeks of clinical preclinical training. At the end of the 4 weeks of intern preclinical training, you will have an exit competency exam. Okay, once you clear the exit competency exam, then you go to the subspecialty training module, which Deepak just would concluded saying what exactly happens in the subspecialty training. Okay, so preclinical is what is the basic foundation course. Once you clear, then subspecialty. Once the subspecialty is also cleared, then you are rotation. Now you are confident in handling all the techniques, all the instruments. Okay, so now ready to go with the patient care. So that is what is the process, what happens. Okay, yeah. So in general, there are about 16 modules which happen in the preclinical training, and depending upon the duration, every program gets how many defined modules to complete under this program. For example, the internship, you have 4 weeks and you have to complete 4 modules. Okay, some people, some, like I said, BS optometry guys, they have 2 years where they have to complete all the 16 modules. Only when they complete all the 16 modules, then they go to the 3rd year of their training. So we have something called PGD program, postgraduate diploma in optometry and vision sciences, where even they have to complete all the 16 modules. Okay, so depending upon the duration, depending upon the entry of the program, we have defined how many modules they have to undergo and how many modules they have to complete exit competency, and then they can start with the clinical rotation. So for the clinical internship, it is your syllabus is to complete 4 modules, so which I'll be discussing in later my slides. Okay, so these are the total 16 modules which will be part of the preclinical training. So like clinical etiquette, where we teach them what are the do's, don'ts of the clinical examination room or the clinical, while you are performing the technique, what needs to be there. And we do have something called how do we elicit the clinical ocular history, visual acuity measurement. We do have spectacle assessment, that is the manual lensometer. We do have an objective refraction, subjective refraction. Somewhere we go with the posterior segment examination, visual function assessment, where we need to teach them contrast sensitivity measurement, stereopsis, color vision. Okay, we do have a sensory motor examination. Okay, and then we have something tear film dynamics assessment and the examination of the lacrimal drainage. So we do have a different modules. Okay, so like I said, so all the 16 modules, so each training program we have defined how many modules they have to undergo, and what in each module, what are the various topics they have to undergo. So every skill, every training program has a defined skill set which they have to complete it by the end of their preclinical training. This is well defined, and this is what happens as per the program. Okay, so and also under each program we also have a different levels, like fundamental level, intermediate level, advanced intermediate level, and the advanced level. Okay, so depending upon again the duration, depending upon the entry level, we do teach either it has to be at a fundamental level, or it has to be at a intermediate level, or it has to be at a advanced level. So on each topic we do, for example, when we take about the refractive assessment, okay, refractive status assessment, which is the objective refraction. If it is only at a fundamental level, we teach them only the static dye refraction using a retinoscope. If it has to go at an intermediate level, we teach them using a retinoscope, and you also teach them the cycloplegic refraction, dry flash, and also a cycloplegic refraction. If it is at an advanced intermediate level, they get an additional called dynamic refraction also will be taught as part of the preclinical training. If it has to go with the advanced level, they undergo the dry refraction, they get a cycloplegic refraction practicals, they get a dynamic refraction, and also they go with the autorefractometer. So for each topic, okay, for each module, again, it has gone into different packages, fundamental to the advanced level package. Okay. So when it comes to the internship, okay, so it has, like I said, anything new, but whatever you learned it in your first year, second year, and third year, the same techniques, you get a reinforcement of the clinical techniques. Okay, you will practice it on each other so that you will become more confident in doing the technique and in handling the instrument. Okay, the same techniques, whatever you learned it in your first, second, and third year. Okay, so you learn again the same techniques, but there will be a uniformity across the network. Okay, so earlier what used to happen is that the preclinical training used to happen at the Hyderabad campus. All the trainees who are selected for the internship, they used to come to the Hyderabad campus, they complete their preclinical training, and then they join their clinical rotation at their respective campuses. But this time, even the preclinical training is happening at your respective campuses. The syllabus is the same, the training process is the same. Okay, so everything remains the same. Okay, so you start it on how we going to start. The syllabus for the week remains the same. So if you take any trainee who is undergoing a internship program and undergoing preclinical training, the week one, the syllabus what the trainee undergoes in the Hyderabad campus or in a GMRV campus or in a KVC campus or in MTC campus remains the same. At the end of the 1 month, okay, so that assessment also is the same. So the way how the trainees at GMRV undergoes the assessment pattern, the similar pattern happens in the KVC in all the other campuses. Okay, so that uniformity is what is we are maintaining. Okay, and the way how do we teach is also we are going to have it as much as possible. We are going to run it in the similar mode in all the campuses. It's not that one campus are going ahead of compared to the other campus. It remains the same, and we move it in the same manner. Okay, so what exactly happens is that you will undergo total 4 modules in a 4 weeks of duration time. Okay, starting from Monday, which is July 4th, and your preclinical training continues till July 30. So after that, the first week of August will be your assessment. Okay, so in the 4 weeks of time, you will undergo 4 modules of training. So that is the eliciting clinical history, visual acuity assessment, refraction, and anterior segment examination. And the training happens from Monday to Saturday, morning 9 to evening 5, which includes both theory and the practicals. This is same across the network. Okay, so under each module, for example, under the eliciting clinical history, you are going to learn how to elicit a case history for an ophthalmic patient. What are the different components we have when you elicit the clinical history? Like So we do have a different components. We ask about the patient's family history. We ask about the patient birth history, systemic history, medical history, right? So likewise, what are the various components we do have when we are eliciting the ocular history? How do we document it? How do we make a differential diagnosis at the end of the history? So this is what is you are going to learn under the first module. Okay. And the second module is what is we have got on visual acuity assessment. So in LVP, we don't, as of now, we are entirely, we are going on a CompLog visual acuity units. These are what is the, like, it's not an exactly electronic, but we do have an electronic, we don't have a physical charts. Okay, so something new you're going to learn. So how do we record the visual acuity using this CompLog units, and how do you record convert from one notation to the other notation? Like some might have learned it in recording it in a Snellen fraction, and even in a Snellen fraction you might have recorded in a metric notation. But here we LVPI follow using a feet notation. Okay, so if you have learned it in a logmar notation, how do you convert it into Snellen feet notation? Or how do we convert from distance when you are not doing it at a 3 meter distance, when you are doing it at 2 meters? How do you convert the visual acuity for various distances? And when the distance conversion is not possible, what are the various ways? How do we record the visual acuity of the patient? All those things you learn it, not only for the distance, what happens for the near. So you learn the visual acuity assessment for distance and near. And the third module is the refraction module, where under the refraction module, you are going to learn 4 different topics. That is a lensometer, where you are going to learn on single vision bifocals, okay, objective refraction, which is a dry refraction, both sphericals and a regular astigmatisms. Okay, and you are going to learn the subjective refraction. Under the subjective refraction, you are going to learn 4 different techniques. That is the duochrome, fogging, JCC, and binocular balancing. And the finally, once you have done with all these things, how do you give a spectacle prescription writing? Okay, so this is what is you are going to learn under the refraction module. And the last module is the anterior segment examination. Under the